Hey everybody, welcome back to the Adrenal Fatigue Podcast. It's Danielle and Angela here today. And today we are so excited to have on the show for the very first time, Dr. Michael Platt. And today we're going to be talking about adrenaline dominance and its connection to so many of the common symptoms we hear about from our burnt out community. Often when we talk about adrenal fatigue, we talk about it in reference to cortisol, the notorious stress hormone. And because adrenal fatigue isn't necessarily medically defined, when we say adrenal fatigue, we just want to remind you kind of what we're talking about. And we do have a podcast episode dedicated directly to this conversation. So check out episode 2 if you are wondering, like, what is adrenal fatigue? What is it as a technicality? What are these girls talking about? Episode 2 is where we break that down in details, listed in the show notes. But essentially, in a nutshell, we're referring to burnout from stress in any capacity. So if you don't feel like you're thriving in your body and stress is getting you down in some shape or form, and to feel like you don't have energy, that's what we're talking about. And so generally speaking, we use testing in our practice to look at cortisol levels throughout the day. And we talk about cortisol all the time, but we're not necessarily talking about adrenaline or looking into what's going on with our adrenaline levels. So this is why this conversation with Dr. Michael Platt is going to be so interesting today. So before we jump into the episode, Angela is going to tell us a little bit about Dr. Michael.
Dr. Michael is board certified in internal medicine and president of Platt Wellness Center and one of the most well-known specialists in natural hormone replacement, successfully treating thousands of patients all over the world. Michael is also a well-renowned author, with his book Adrenaline Dominance being the only book ever written that explores how excess adrenaline affects our body. Michael has also written other books like The Miracle of Bioidentical Hormones. In 1995, Dr. Michael opened a clinic in Palm Desert, California, where he began employing his Platt protocol, a natural approach to hormone balance and wellness. And in 1997, the Platt Wellness Center became a leader in the research and advancement of therapeutic use of progesterone cream, as well as other bioidentical hormones.
Yeah, so we're so excited to have you here to have this conversation today, Dr. Michael. Thank you so much for being here.
It's my pleasure.
So we'd love to just start with the basics, and maybe for our audience, if you could just give us a quick refresher about adrenaline, and just if we could chat a little bit about how it's different from cortisol.
Okay. Well, adrenaline is both a hormone as well as a neurotransmitter. And when people have a lot of adrenaline, and we'll go into that, it actually creates stress to the body, and the body responds to stress by putting out another hormone called cortisol. And again, now cortisol is not a happy hormone. You know, it's not good for the immune system. It creates fat because it raises sugar levels, and it can cause osteoporosis. So again, it's not acceptable for people to have lots of cortisol, and it's not acceptable for them to have lots of adrenaline. They're both, like I say, unhappy hormones.
On that note, are the two hormones, are they generally released together, or could they be released separately? I'm just thinking, like, if we're looking at like a Dutch test and we see that cortisol is high, like would the adrenaline be high as well, kind of thing?
Well, basically, the only thing that raises cortisol levels is excess adrenaline. So the answer to your question is yes, adrenaline will always be high when cortisol is high. Now, keep in mind that adrenaline peaks at 2:30 in the morning.
Okay.
And the reason why the body's putting out adrenaline is not because people are in danger. I mean, that's, it is a fight or flight hormone, but danger is a very rare reason why the body puts out adrenaline. The primary function of adrenaline is to raise sugar levels for the brain. And most people do not realize that the brain actually uses more sugar than any other tissue in the body. And anytime the body detects that the brain is running out of sugar, it just simply puts out adrenaline to raise glucose levels back up again. So when the body puts out adrenaline around 2:30 in the morning, it creates stress to the body, and the body responds to this by putting out cortisol. And the first thing cortisol does, it also raises glucose levels by a different process called glycogenolysis. And so now, while people are lying in bed, they're putting out two hormones that raise sugar. And most people know, when people are trying to lose weight, sugar is not the best thing that they should be associated with. And I am fairly well convinced that excess adrenaline is the number one cause of weight gain, and nobody ever talks about it. So people diet and exercise during the day, and they can't figure out why they're not losing any weight. It's because they're putting weight on while they're sleeping.
And that would wake you up too, right? To have that spike. So we'll get into that in a bit, but like sleep issues.
Adrenaline gets people that urge to urinate. And a lot of people wake up at 2:30 in the morning and have to urinate.
Wow.
During the day, especially women, they may find that whenever they have to urinate, when they have to go, they have to go. On television, they call this an overactive bladder, but what they're experiencing is adrenaline. Adrenaline gets people that urge to urinate. Some women, while they're running to the bathroom, they lose urine, and they call that urgency incontinence. Again, very easy to fix. Everything we're going to be talking about today is easy to fix. So I just want people not to get depressed while they listen.
Okay, well, these are really common symptoms for a lot of our listeners. So I'm sure everybody's going to be anxious to hear more about what we can do about this. But one question before we move on from the cortisol adrenaline connection. A lot of the times, like on the Dutch test, we were talking about when we see cortisol being high, adrenaline would also be high. But what about the cases when we see cortisol like flatlined through the day? Would adrenaline also be high in this scenario?
Well, again, we have to be careful. We're talking about saliva test or blood test.
Yeah.
And
well, the Dutch test is urine.
Oh, well, I'm not a big fan of urine tests. I'm not a big fan of saliva tests. The ideal thing when it comes to hormones is to treat people, because you can never go wrong treating a person. You can always go wrong treating a blood test or urine test or a saliva test. But the only kind of testing that I would recommend is blood testing. Anyway, that's what I feel most comfortable with. That's me.
Okay. So if we wanted to test if our adrenaline is high, of course, like you mentioned, there's going to be a lot of symptoms that can be associated with this, which we'll get into, but you just like to test via blood. Like, is there a test for adrenaline specifically, or would it be a different marker?
Well, interestingly, the best test for excess adrenaline is actually a blood test of cortisol in the morning before 9 o'clock. And now they have to be careful and when it comes to cortisol testing in the blood, because they used medical students in hospitals to determine what normal levels of cortisol should be. And people have to realize that doctors have a lot of adrenaline. And these are medical students who become doctors. And so what they have as a normal cortisol level, they allow the range to go up to 19.4. 19.4 is really high when it comes to cortisol. Anything above 14 is really high. So again, you just have to look at the levels that you're getting in perspective. That's why I'm saying it's always best to treat people. I don't need a blood test to know if somebody has a lot of adrenaline. I just will let you know that.
Cool. Thank you for clarifying that.
Okay.
And I want to hear more about what you referring to when you said, treating the person. So I think we can talk about that a little bit later, but I probably know a little bit about what that means, but I'd love to hear more about what that looks like for you. But I'm curious right now, can you share conditions you see most these days that commonly arise with excess adrenaline that people really aren't making connections to, and those signs and symptoms to really look for?
Okay, well, let me first give you the signs and symptoms. People that have a lot of adrenaline, it's the number one reason why people have trouble sleeping. Some people grind their teeth at night, some people toss and turn, there's something called restless leg syndrome. This is all adrenaline. Now, aside from sleep problems, anxiety is only caused by excess adrenaline. Other things that people will manifest when they have too much adrenaline, cold hands and cold feet is caused by adrenaline. And the reason for that, adrenaline as a survival hormone cuts off blood supply to certain areas of the body not needed for survival. So that's where the cold hands and cold feet is not a thyroid thing. It's adrenaline, even though most doctors and most people think it's a low thyroid. The other thing, it cuts off blood supply to the intestines because they're not needed for survival. And that's where irritable bowel syndrome comes from. And when people have a lot of adrenaline, they almost always carry tension in the back of their neck. And this can lead to tinnitus, and it can lead to headaches. Um, you may have run into people that complain about migraine headaches. And what's interesting is that in my clinical experience, just about every patient who thought they had migraine headaches had a different type of headache called occipital neuritis. And occipital neuritis arises from the occipital nerve sheath, which is at the base of the skull on each side. And when people have a lot of adrenaline and the muscle tense up and they squeeze that nerve sheath, it causes excruciating headaches. And very often these headaches shoot right into the back of the eye. Why it's important to differentiate this from a migraine headache is that migraine headaches are tough to treat. These, occipital neuritis is very easy not only to eliminate, but also to prevent. So, and we'll talk about how to do that later on. The other thing about adrenaline, it's an anger hormone. You may have heard of something called road rage. Road rage is only caused by excess adrenaline. And when people are quick to anger, that's adrenaline. And they actually have a condition that women have called PMDD, premenstrual dysphoric disorder. I don't know if you've heard of it, but it's found in about 8% of women that are menstruating. And these are the women that for about 10 days out of the month, nobody can live with them because they have severe anger issues and severe mood swings. And, it's one of these conditions that doctors don't know what causes it, and they certainly don't know how to get rid of it. But it's a condition caused by excess adrenaline. It's one of the conditions that people have that doctors don't know what's causing it. You may have heard of fibromyalgia. It is another condition caused by excess adrenaline that doctors say they don't know what causes it, and they certainly do not know how to treat it. You may have heard of ADHD. ADHD is all about adrenaline, and you can actually get rid of ADHD in 24 hours just by lowering adrenaline. And what's interesting is that the drugs that they give to children for ADHD, like Ritalin, Strattera, Adderall, if the child didn't have ADHD to begin with, the drugs would give it to them, because all these drugs do, they increase adrenaline levels, and what it does, it numbs the brain, because of just with so much adrenaline. That's why children don't like these drugs. And one of the side effects of these drugs is sudden death, but that's an acceptable side effect for our medical system, is sudden death in children with drugs. Anyway, so people with adrenaline, like I say, cold hands, cold feet, tense muscles, anger, trouble sleeping, anxiety. Okay.
Yeah.
But there are a lot of conditions that I didn't mention that are caused by adrenaline. Okay, your turn.
We want to hear more for sure. I want to pause and maybe ask maybe a very obvious question, but I'm curious your perspective is the root of excess adrenaline. Is it just, daily stressors? I'd love to hear your thoughts on this.
Well, it's true. We do live in a very stressful world, but when it comes to adrenaline, excess adrenaline is strictly genetic. In other words, if a person has excess adrenaline, one or both parents had excess adrenaline. It always runs in families. That means that any child that has ADHD, that means that one or both parents have ADHD. And children with ADHD grow up to be adults with ADHD. It doesn't go away. However, while we're talking about ADHD, I should mention that the most intelligent, successful, creative people in the world have ADHD. ADHD is not a bad thing to have, even though people think it's a stigma, that think it might be a learning disorder. The whole thing about ADHD is it's not a learning disorder, it's an interest disorder. Children with ADHD have no trouble focusing on things they're interested in, but if they're not interested, they will not focus. But just by lowering adrenaline, all of a sudden they can focus on everything. And remember, they already have enough, it's the adrenaline that gives them intelligence. And adrenaline also enhances people's creativity. In fact, the most successful people in the world have two different types of ADHD. I just want to let you know that. The heads of every major corporation probably have two different types of ADHD, and very few of them ever finish college. And yet they're heads of corporations. So,
Wow.
That's interesting. Interesting what you said about ADHD too. I appreciate that perspective. And I also feel that, having children of my own and the energy level, I definitely appreciate what you said, and also think of it as the boxes that we also have to fit kids into these days. And right, just to be able to, most kids don't really always function in the institution, or don't thrive in that institutional way where everyone has to stand in a line and these certain things. So I feel like children who have these big spirits, right, they come to this world wanting to create and do all these wonderful things in the world. They have all this amazing energy, and it's a lot of times being, shunted and put in a box, and this is the way you need to behave, and this is the way you need to be as a kid. And I think that can be very stifling. And of course, it's not going to, it's that sense of wanting to control, right? We have that need to control in a way too. So anyway, that's a different perspective, but I just thought it was interesting that you shared that, and I appreciate that.
well, just like most doctors, I had ADHD growing up, and I used to get up and walk out of class. I had the hardest time focusing. I never opened a book until the night before an exam. It wasn't until I got into medical school that I started studying. And the reason that I started studying in medical school is that I was interested in medicine, but there's nothing in high school or college I had any interest in. So that's what I'm saying. It's not a learning disorder, it's an interest disorder.
I love that.
And
thank you for sharing that part of your story.
I can relate. So I wanted to ask, there's so many sneaky things that we never would have considered to be associated with adrenaline dominance. So this is really cool. But I'm imagining that having excess adrenaline, being quick to anger, we're thinking of it as a hormone that's like quite stimulating, right? So that has to be tiring. So can we just touch on the connection to fatigue? Like, do you see it? Like, what about chronic fatigue syndrome?
Well, theoretically, chronic fatigue syndrome is actually caused by a virus. I'm not sure which one, but whatever. But people with fibromyalgia, they complain about two different things. One is pain, and the pain of fibromyalgia is due to a buildup of lactic acid in the muscle tissue and in the tendons. But people, when they have a lot of adrenaline, they keep their muscle tense. Remember, it's a fight or flight hormone, and they keep the muscle tense 24 hours a day. And this is where the fatigue comes from. I mean, just keeping muscle tense uses up a tremendous amount of energy. So again, fibromyalgia, they complain about pain and fatigue. And again, but just by lowering adrenaline, you can actually get rid of fibromyalgia in anywhere from 3 days to 3 weeks. If I could go on my little soapbox for a second, when we talk about our medical system, people really have to understand doctors are not trained to treat the cause of illness. They're trained to give out Band-Aids. And they get very little, if any, training when it comes to hormones. Even though hormones control everything in the body, doctors get very little training when it comes to hormones. And as people know, they get no training in nutrition. So it's important for people to understand that doctors are not the only answer to what's wrong with them. People have to be proactive, and they have to accept maybe alternative ways of getting better. Anyway, I'm going to get off my soapbox now.
We understand, and we're with you on that. I think. Agreed. Yeah. So on that, I'd love to start, for us to start talking about sort of the ways that you treat the person and the way that you address and work with your patients. And so what are the best ways to balance out your adrenaline levels?
Well, just like any other condition, when people have excess adrenaline, you have to approach it from the reason why the body is putting out adrenaline. That makes sense? Okay.
Absolutely.
Now, what makes it relatively simple is that basically there's only two reasons why the body's going to release adrenaline. One is if you're in danger, it's a fight or flight hormone. But as I mentioned before, danger is a very rare reason why the body releases adrenaline. Unless you live in a war zone. If you live in Ukraine right now, I'm sure everybody there is living on adrenaline. Tragic situation. But anyway, so again, the primary reason why the body releases adrenaline, again, is just to raise sugar levels for the brain. Now, what this means is that if people provide the fuel that the brain requires, the body doesn't have to use adrenaline to do it. So that's what's entailed when I talk about treating the cause. You treat the cause by giving the brain the fuel that it needs. Now, the brain uses two different fuels. One is glucose. That's a type of sugar that it uses. And the best source of glucose actually comes from vegetables. I hate to tell people that, but candy and soda sounds a lot easier. And candy and soda are great sources of glucose. But the problem is they're highly glycemic. What that means is they produce a lot of insulin. And insulin lowers sugar levels, so it defeats the purpose of trying to raise the glucose levels. So the thing about vegetables, they all break down into glucose, they're carbohydrates, but they're low glycemic. They don't produce a lot of insulin. In fact, green vegetables I produce almost no insulin at all. Now, the other fuel, which is, the second fuel the brain uses, which is even more important, are ketones. And I'm sure your listeners have heard of a ketogenic diet, which I don't recommend. And the reason for that, it's a very hard diet to accomplish. If they want to try it, that's fine. But you don't have to be on a ketogenic diet to get ketones. You can get ketones directly from coconut oil or something called MCT oil, medium chain triglyceride oil, which is they can get off the internet or any health food store. The difference is that coconut oil is a great fuel for cooking because it has a very high heat threshold. MCT oil is tasteless, so they can add it to anything. A lot of people put MCT oil in their coffee. They call it bulletproof coffee. They can add also a tablespoon of butter if they want. But anyway, so so coconut oil, MCT oil, and vegetables for the glucose. And the only other thing they'll need is something called progesterone cream. Now, most people think of progesterone as a woman's hormone, and they don't realize that men and women have the identical hormones, different levels, but the same hormones. It's not a woman's hormone. Men stop making progesterone right around the age of 50. And it's after that, when their progesterone level goes down is when they start getting prostate cancer. And they start putting on weight around the middle because the thing about progesterone is that it blocks estrogen, which is the cause of prostate cancer. And progesterone also blocks insulin and adrenaline. The three most toxic hormones in the body, progesterone blocks. And yet most people don't know anything about progesterone, including doctors. But anyway.
That's so interesting.
So progesterone, but it has to be the right strength. What I recommend is a 5% progesterone cream. 5% means that each pump is 50 milligrams. And 50 milligrams is the exact strength you need to block adrenaline. And it is so safe, you can give it to babies that have colic. You rub it on their belly, the colic goes away in about 3 minutes. And if mothers are curious whether or not they're going to have a baby that has colic, babies that do a lot of kicking in the womb are the ones that wind up, because that's adrenaline, and colic is adrenaline. So the babies that do a lot of kicking are the ones that very often wind up having colic when they're born. So you could actually give a full strength, a full pump, 50 milligrams to a baby, and keep in mind that when the fetus is in the womb, it gets exposed to incredibly high levels of progesterone. So you can't harm a baby with progesterone because they're used to it. Okay, so progesterone and MCT oil and vegetables, and you can manage adrenaline all by yourself at home. So
that's fascinating, especially like you were mentioning earlier, that adrenaline dominance is almost always a genetic thing, right? So
Always.
so for those of us who tend to be adrenaline dominant, Angela and myself, I guess we can relate. These simple lifestyle suggestions that you're making can really make a big difference, along with the bioidentical progesterone.
Yes, it can change your life, actually. Both of you are creative type individuals. And the thing about creative people actually have the most adrenaline. You may have heard of women that vomit throughout their entire pregnancy. You only see that in creative type women, and that's caused by adrenaline. They call it hyperemesis gravidarum. You may have heard of bedwetting in children. You only see bedwetting in creative type children, again, because they have the most adrenaline. And you can get rid of bedwetting in 24 hours. Some kids deal with it for years. But again, it's just a matter of treating the cause.
Wow.
You can get rid of ADHD in 24 hours just by lowering adrenaline.
Okay, so how do we get our pause on progesterone cream? Is it legal to buy over the counter, or do you need a prescription?
Well, you can either get it by prescription from a compounding pharmacy, or you can actually go to my website and get a therapeutic 5% strength, www.plattwellness.com. We have two different types of progesterone cream, one with oil of lavender, one without, but they're both equally effective. I've written a book called Adrenaline Dominance. Just to give you an idea, it's the only book that's ever been written that talks about the clinical consequences of too much adrenaline. I mean, nobody ever talks about, people don't appreciate the cause, how important it is to approach illness from the cause. They have functional medicine doctors who unfortunately know nothing about adrenaline, even though that's the cause of so many conditions. Bipolar disorders, is caused by adrenaline. Even separation anxiety in dogs is caused by adrenaline. And you can treat that with progestin cream applied inside the ear. It goes away in about 1 minute. Anyway, just for those dog lovers.
Would you use a different dose for animals? Probably.
Well, you can't. What's nice about progesterone, you cannot overdose on it. So, whatever seems to work for the dog is fine. You can't hurt them with it.
Okay, because I was going to ask, we were curious if there's any cases where it's not recommended.
I'm sorry?
We were curious if there's any situations where you wouldn't recommend using progesterone.
There is. Have you ever heard the term type 3 diabetes? You've heard type 1, you've heard type 2, but there's also a type 3 diabetes. And type 3 diabetes, the other name for it is insulin resistance in the brain. And what that means is that the insulin in the brain has a real hard time getting glucose into the brain cells. And why it's important to know that you might have what's called type 3 diabetes, it's probably the #1 precursor to Alzheimer's disease. And the whole thing about Alzheimer's, it's a disease of prevention. If you know you're going to get it, you can prevent it. So what happens with progesterone, one of the benefits of progesterone is that it creates some degree of what's called insulin resistance. Now, this is a benefit because it prevents people from getting sleepy in the afternoon when insulin peaks, prevents people from getting sleepy after eating. It prevents people from getting sleepy when they're driving. So these are all good things. But if somebody already has insulin resistance in the brain to begin with, and they use progesterone, immediately there's a sudden outpouring of adrenaline, again, because the body recognizes it's even harder now to get glucose into the brain cells. So if somebody was to use progesterone and all of a sudden get very tense or anxious and have anxiety and palpitations and, in other words, feel like they have a sudden outpouring of adrenaline, they have problems with insulin resistance in the brain. Now, sometimes that can be caused just by the fact that they don't have any fuel in the brain. They don't eat vegetables, they don't use coconut oil, CT oil. So in that case, what they would need to do is just start adding those into their meal plan and then retrying the progesterone. But they don't have a test for type 3 diabetes. But a test could be using progesterone, and if they get that kind of reaction, then whatever. And then once you know that you have type 3 diabetes, then you just add a lot of MCT oil into your meal plan to prevent you from becoming somebody with Alzheimer's.
Okay, fascinating.
You actually may have heard that some people with Alzheimer's have been cured with coconut oil. But the reason for that is that the coconut oil is converting into ketones and helping. So.
Very cool. Okay, definitely going to be adding an extra squirt of my MCTs into my coffees this week.
Okay.
But coming back to the progesterone and you mentioned a couple of the side effects, and these are really common with a lot of our listeners. So really, we're grateful for you highlighting them. What about like insomnia? Same thing? Because I know some people try supplementing or doing the bioidentical progesterone. That's one of the symptoms that we hear about, is like all of a sudden they're having trouble sleeping.
Well, again, they may not be using the full strength, the 5%, because most over-the-counter progesterones are 2% or less. In fact, almost all, 99% of them are. So number one, they may not be using the full strength, or number two, they may have some degree of insulin resistance because they're not using vegetables and coconut oil and MCT oil, and they're getting a little bit of insulin resistance, and that will cause the body to put out more adrenaline. So it's another reason why that can happen. But from a safety standpoint, progesterone is pretty safe, really is. Now, again, people have to be careful where they're putting it. They want it in the bloodstream, so they want to put the progesterone cream where the skin is thin, and the forearms. Not only is the skin thin, but there's a good blood supply, in the forearms. So they would put a pump on their forearm and then rub the two arms together. The back of the neck is another excellent place to put it, especially if they have tension there. Upper chest they can use because the skin is thin and there's a good blood supply. And that's about it. You want to avoid the abdomen, and you don't want to put it over fatty tissue because it'll go into the fatty tissue.
Very helpful. Thank you. Okay. So if a person, you mentioned earlier how you don't necessarily need even blood tests. You said the best way to see if you have dominance is to do a blood test. And you said, but you don't even necessarily have to do a test. So if let's just say a patient comes to you, how do you normally navigate that? Is it maybe just first listing out their different symptoms, and then from there you can tell, or do you always kind of confirm with a blood test? And then, yeah, that would be my first question.
The 90% of a diagnosis is sitting down talking to a patient. 90%. I had a gentleman that came in to see me a number of years ago, and he was 47. And the reason why he came to see me is that every morning he would wake up and vomit. The only thing that'll cause that kind of vomiting is adrenaline. There's nothing else that'll cause that kind of vomiting. And he had severe fibromyalgia, severe. And so I put some progesterone cream on his arms, and we started talking. And after about 5 minutes after I put the progesterone on his arm, he sat back in his chair and he looked at me and he said, "Doc, in my entire life, I have never felt this good." And so that's how quickly, blocking adrenaline can cause somebody to feel better. And it's very rewarding to get people to feel better. Doctors very rarely see it, but it's one of the few perks of being a doctor is to get somebody to feel better. And the only way you can get people to feel better is to treat the reason why they don't feel better. And I keep on stressing that, is that the only way you can cure somebody is to treat the cause of their problem. And doctors are not trained to treat the cause of illness, unfortunately.
Right. Okay.
So anyway, so I don't know if I answered your question just then, but like I say, when somebody comes in, it's not difficult to know if somebody has a lot of adrenaline. They have, sleep issues, anger issues, and anxiety, is only caused by adrenaline. But like I say, and the other thing is that, creative people, I mentioned have the most adrenaline, and, and I mentioned earlier before, when it comes to cortisol and adrenaline, they're both raising sugar levels. So it's like I say, the number one cause of weight gain. I mean, look how many people are fighting weight all the time. And creative people, especially creative people, are the ones that have weight issues. And people get into drugs and alcohol, just to relax. It's probably the number one cause of addiction is adrenaline. I'm just saying, it's just, and okay.
Mm-hmm.
Yeah, thank you. So so you sell this on your website? Do you ship it across the states? Is it available in Canada as well?
Did you say Canada?
Yeah.
We send progesterone to Canada. We don't send it as progestin cream because Canada won't let it in.
Okay, that's what I was wondering.
We send it as a body cream.
Okay. Okay, so it is safe for people to just go on your website and buy it, right? Or would you recommend they have a consultation with someone like you?
I never discourage people from talking to their doctor. And I'm available to answer questions all the time. I even have a hormone evaluation thing on my website, but like I say, it's not hard to find, to realize that somebody has a lot of adrenaline.
Yeah.
You have to trust me on that.
Yeah. I could see. Okay. So yeah, that's great. So as far as it sounds like with your patients, you see results actually fairly quickly from some of the examples that you've given. Would you say that's pretty consistent across the board, or you said there's a protocol, I believe, that you have. So can you tell us a little bit about, you talked about the LEGs and the MCT and the progesterone. And I'm just curious as far as thinking about those things, like if someone just like, okay, well, I'm going to do what he said there, and I'm going to take these 3 things and I'm going to implement them. Is it that quick results, and does it matter if, the rest of the day they're drinking soda and coffee and, and, I just wanted to kind of touch on what your other pieces maybe of your protocol, how quickly it takes. So I'm kind of merging several questions in one, so you just take with it what you want.
Well, first of all, if somebody has a lot of adrenaline and they start using progestin cream, literally within a few minutes they'll feel much more relaxed, and they'll be able to focus better. When people have a lot of adrenaline, the mind goes so quickly, it's hard to focus unless they're interested in something. But once you lower the adrenaline, then they can focus on everything. And so that's something that they experience right away. They should be able to start sleeping. If they're eating correctly and using progesterone, they should be able to start sleeping better right away. Now, road rage can go away in 24 hours, and I don't know if, there seems to be a lot more road rage nowadays anyway.
Right.
Well,
we have shorter fuses, I think. We're very impatient these days, I feel like, with just technology. We have everything instantly at our fingertips.
Yeah.
Yes.
But even, look, this whole thing about COVID has created a lot of anxiety for people also. Anxiety is pretty rampant nowadays. But
it certainly is.
Yeah, but progesterone is a natural antidepressant. It's a feel-good hormone. And also for women, not only will it help with their adrenaline and their insulin, but you remember it blocks estrogen, so it can get rid of cramps and PMS, and and look at all the women that are on birth control pills. When women are on birth control pills, they stop ovulating, which means they stop making progesterone. And progesterone is the most important hormone in a woman's body. And doctors take that away from them when they put them on birth control pills. So they wind up with fibroids and endometriosis and polycystic ovaries. And, I'm just saying, people have to be really careful about what they're doing to themselves.
Yeah, it's really tough. A lot of people come to us and the choices that they're getting from their doctor that they don't feel well. It's like either birth control or antidepressants, and a lot of people aren't willing to do that, or maybe they're trying those things but they aren't working for them. And so you're preaching to the choir here. We understand we love that work that you're doing in the world, because this information is really important.
Dr. Michael, I'd love to come back to something you mentioned earlier. The prostate cancer. I was wondering, because don't they normally, isn't there treatments to block testosterone? I'm you mentioning the estrogen thing is new to me. I'm by no means an expert in this, but I've heard of treatments where they're blocking the testosterone. But you had mentioned the estrogen and the progesterone. So I was just curious.
In Europe, they actually use testosterone to treat prostate cancer. The thing about testosterone, it does downregulate into estradiol. And estradiol is one of the 3 natural estrogens. It's my least favorite hormone. Most men, if they live long enough, will have prostate cancer. But what men should really realize that only 7% of prostate cancer is the kind that spread. So 93% of men will die with prostate cancer instead of from it. And personally, I try to caution men to avoid having prostate biopsies. When they do a biopsy, they actually do 12 to 24 sticks, where they put the needle into the prostate 12 to 24 times. Wonderful example of how the prostate cancer can get right into the bloodstream and spread. So I do not recommend biopsies, but that's my own feeling. There's a blood test that everybody's heard of called a PSA, but there's also another test called a free PSA test. And when the level is low on a free PSA test, it's a pretty good indication that there's probably a cancer there. So, so once you know that you might have cancer, the whole approach now is to try to prevent it from spreading. And they have all sorts of supplements that can help, prevent the spread of prostate cancer. So anyway, I don't recommend prostate cancer, but there are different ways of approaching it. So,
thank you. Yeah, that's
now what's nice, but again, now the thing about progesterone is that it blocks estrogen, which is the cause of prostate cancer. So I just want to let you know that. And and estradiol causes 6 different cancers in women, including breast cancer. So progesterone prevents every cancer that estrogen causes. So again, progesterone is an incredibly important hormone for both men and women. And one more caution while we're talking, they have an oral progesterone called prometrium. And women have to be very careful about oral progesterone because it goes orally, it goes through the GI tract, which means it stops off the liver before anywhere else. And the liver converts it into a different hormone called allopregnanolone. This is why they give it have women take the pill at bedtime, because it has a side effect of making you sleepy. But oral progesterone converts into a different hormone. They're not getting progesterone. So I just want people to be aware of that. And yet that's the number 1 progesterone that's prescribed nowadays is oral progesterone. I just want to let you know that, okay?
Thank you for sharing. A lot of this is probably new for our audience, and for us, we're learning a lot here. So thank you for sharing all of your wisdom today. And is there anything else that you want to share with our listeners before we close today?
Wow. I just want people to understand that they really have to become proactive when it comes to their health. They can't rely on a medical system that is controlled by drug companies that has no interest in their being healthy. And they have to be aware of that. Drug companies control what doctors learn in medical school. They control the medical boards. They control the FDA. They control everything. And the whole medical system thrives on disease and illness. It does not thrive on wellness. So that's what I'm saying, that people have to become more aware that there are alternative approaches to health, and nutrition is so incredibly important. Anyway, so what can I say?
Thank you. I appreciate that. And we agree. Being proactive and being your own advocate and knowing that there's other solutions out there. I think that's one of the biggest things that why we're so passionate about what we do, is knowing that there are other answers. It's not just go to, this is my life. This is how it's going to be. I have this condition and I'm doomed to feel this way for the rest of my life. So we really appreciate, again, your perspective and your all that you have learned and sharing with us today about what you do in your practice. It's very helpful and eye-opening. So I think we just love to be able to tell our listeners before we end where they can find you.
Well, my website is www.plattwellness.com. plattwellness.com, and if they call the office number, usually it'll go straight through to my cell phone. I'm pretty easy to get a hold of. I think if people are interested, I think they're offering a promo code. If they go to my website and order something, and it's called Adrenal 10, they get 10% off.
Oh, amazing. Thank you. And I will we'll have everything linked in the show notes for people as well, for easy access. So if you're watching on YouTube, it's in the caption, and on the podcast, it's in the notes.
Wow. Okay. Now, do you guys have any questions?
We just gave a lot to you. So I think we're full, and we're just appreciating all that you shared with us and our audience today. So
yeah, and I would encourage our listeners, if they have any follow-up questions, to definitely let us know at the Adrenal Recovery Collective. And Dr. Michael, I think you're just a wealth of information, and I think that this has been such an insightful chat, kind of a different angle than what we've had here on the podcast before. And I think it's going to be really valuable for our listeners. So if they have some questions, maybe we could do a part 2 down the road and see what they'd like to hear more of from you. So I'll open up the floor to them.
Yeah, I would enjoy that. If they have questions, I'd be glad. Yeah, that's fine.
Perfect.
Great. Well, thank you so much for being here with us.
Well, it's been my pleasure.
Thank you.